Good afternoon, everyone. This is Andy Reese. We appear to have about almost 130 participants at this point, so we can go ahead and get started. As a reminder, this is being recorded, and the recording, along with a transcript of this, will be posted on our website as soon as they're available. Just wanted to give people a brief update. To date, we have had 86 people we support who have tested positive for COVID-19, and provider agencies have reported 75 staff testing positive for COVID-19. Among the people that we support, 14 have died from COVID-related illnesses, and amongst provider agencies, there have been 2 deaths related to COVID-19. To give some little bit of context, in terms of the 86 people who are currently diagnosed, 31 of those folks are in the hospital, 15 were in the hospital and have been discharged, and 26 never required inpatient care. Many of them are also asymptomatic and are being monitored in their homes. We seem to have a number of questions today, so we can go ahead and get started with those questions.
Okay. Good morning, everyone. We have several questions in regards to the Appendix K, and we just wanted to share that a transmittal will be issued next week on the Appendix K rates and procedures. So we will not address any specific questions. In the event that an employee works for multiple provider agencies and the employee has to quarantine, who is responsible for notifying the other provider agencies where the employee works?
So whenever anyone tests positive in the district, which also applies to the outlying jurisdictions, a report is made to the local health department, and they then connect with that person and talk to the person about the necessity of self-quarantining, the steps that they have to take to monitor their own health, care for themselves, and ensure that there's no transmission of the virus. The mayor's order that was issued last week also does require all provider agencies to report to the district agency they contract with when an employee tests positive, and to provide us that information. And we, after that mayor's order was issued, have coordinated with DC Health so that we're working with the epidemiology unit over at DC Health to make sure that they have all the names and all of the information. So if there were a concern about someone who had been diagnosed with COVID-19 that was not taking the right actions, we would make that report over to DC Health for follow-up. The other thing we have been doing, and we have almost 90% response so far, I think, from our providers, is making sure that we have a list of all current employees so that we can match and have a clear idea of how many employees work in more than one site so that we can stay on top of that.
In previous meetings, DDS indicated that providers could apply the extra supply ordering against other line items within the HCA. Please indicate the process of how that would be done and if any updates are needed to ensure compliance with the HCA.
I think that's not exactly what was said, but just to clarify for people, if the amount on a particular line item of the HCA is not adequate for the supplies that you need, you should be reaching out to your contract administrator. Also, when obtaining PPE, many of our agencies have been working with HEPRA, which provides PPE to them at no cost. So people should be able to obtain PPE there as well. I understand providers are also getting it on their own. So to the extent the human care agreement, the cost for the year for that particular supply is inadequate, you should be talking to your contract administrator.
Okay, and we have a comment. Thanks to all the providers and DDS for partnering and being there when other providers reach out for help. It means a lot. Why is the dashboard being used as a tracking system now to remind us of routine medical appointments when we all know doctors and dentists are only open for urgent necessary visits? We have enough to manage keeping our heads above water and would appreciate another system of tracking to be considered during this time. The dashboard tracks our compliance, and we are not able to timely resolve appointments and will receive a less than satisfactory rating from DDS when issues are not closed timely that are out of our control due to COVID.
Actually, and other folks can correct me if I'm wrong here, so if there's an appointment scheduled and it's on the dashboard, all that the provider agency has to do is contact the doctor, as you say, most likely, and this wouldn't be 100% of the time, but in most instances, the doctor would be pushing that appointment off for some time. And if they're doing that, then you enter a note saying that the doctor felt it was in the person's best interest to delay the appointment until X date due to the COVID-19 public health emergency, and the issue's resolved. The dashboard, I understand that it's used to track issues is the way people feel about it, but it's also a tickler system to make sure that people's routine health care is managed. And so it's essential that we continue to have these reminders on the dashboard.
I am wondering if the individual DDS-held bank balances are being monitored and updated as they become over-resourced if when they receive additional income due to the pandemic and lose their Medicaid.
So the issue of the stimulus checks that will be coming out to people, those funds are treated the same as back payments by Social Security, and so they don't count toward resources for 12 months. And so, you know, providers should be working with people they support on making plans for managing the person's funds to make sure that they don't get over-resourced at any time, including keeping an eye when they get that $1,200, if that's what they receive, on, you know, what they would want to spend those funds on, what are the various options for having that somewhere where it doesn't affect their resource levels for Medicaid.
Can you please provide more clarification on the mayor's order of wearing face masks within the home as it pertains to host home and in-home support settings?
So the mayor's order that was issued last week does not apply to host homes or in-home support. It doesn't apply, essentially it doesn't apply to people's homes. And so there wasn't an imposition requiring people who work as a host home provider to wear masks in a particular circumstance. They are not being treated in this order like staff. At the same time, we should all be reminded that there are other separate mayoral orders out there, and there's public health guidance out there from DC Health about when it is appropriate to use a face covering or a mask. You can go to our website, the dds.dc.gov, and see all the various guidance that's been issued regarding this issue that's come from DC Health that focuses on ensuring health and safety for everyone. So it provides recommendations and requirements. For example, when going to the grocery store, one's required to wear face covering. And also keeping in mind the circumstances under which one must use various types of personal protective equipment. There was a very thorough guidance issued by DC Health last week that addressed a number of areas for providers where they're providing care and in different circumstances what the appropriate kind of cloth face covering, N95 mask, surgical mask, gloves. It really gives detailed information about different kinds of procedures that staff might be doing and when different PPE or face covering is required. But in terms of the question about host homes and in-home supports, the mayor's order does not address those two. Always remember the issue of social distancing. For people who do provide in-home support, you should also review, there's DC Health guidance for human service workers regarding face covering and working in the community, and it provides guidance about how to conduct those, how to provide those services.
And someone has a follow-up comment. If that information was already on the medical chart, then it shouldn't be put on the dashboard.
I'm going to let Winslow answer that.
With regard to tracking the appointments on the, if it was already on the medical chart, then it shouldn't be put on the dashboard. I'm really unclear with regard to that response, because if it's on the, when you say medical chart, I'm not understanding that. We don't have a medical chart in the MCIS.
Unmute Precious Brown, Myers Brown, to clarify your comment. Hi, Precious.
Hi.
Hi, Precious. I was just trying to get some clarification on your.
Yeah, can you hear me?
I can.
Okay, thank you. So in our medical chart under the appointments, what we do is if the doctor, because we call the doctor ahead of time, are you going to do a televisit? Are you going to do transfer the appointment or reschedule the appointment to a later date? Whatever the information we receive, we put it in the charts in the appointment in our chart on the electronic health record in that information. But although that information is there, we're still seeing those things pop up on the dashboard.
Okay, so for that, if you could send me the actual list of people and we'll look at that. But with regard to the question in general, we can't have like a system. All providers don't have electronic medical records or that level of system. So right now we're unable to kind of have a system for those who have that level of detail in their records and that our staff access, because we do have people who have medical records or records that our staff access. So thank you for that. I look forward to the list, and I'll work with QACMA to see what we can do about those issues.
Thank you.
Okay. 2 weeks ago, a question was proposed to have DDS provider agency come together as a large group to purchase PPE since we are all not able to buy them individually. Last week during holistic presentation, it was mentioned that the coalition members purchased PPEs as a group for the members. Not all providers are coalition members, and this pandemic is not only affecting a few, but all. I wonder why this opportunity was not provided to all provider agencies.
So one of the services that the DC Coalition of Service Providers offered to its members was as a group to make that purchase. And so it wasn't extended beyond that because it was a service of the DC Coalition of DD Service Providers that did it. And so for non-members, they did not extend it to all providers. They do extend to all providers annually the opportunity to join the coalition.
Okay, are there any additional questions at this time? Is there any obligation to disclose to a leasing company that a tenant has tested positive to COVID? A whistleblower has reported to the property manager the test results, and we're now being pressured to disclose.
So if there's and I don't know if DC Health is on the line and able to answer, but if there is a positive test result, it is communicated to DC Health. And health departments, I believe, disclose to apartment buildings to provide notice that, not identifiable, but to provide notice that a person in the building tested positive, so that the building is aware and can ensure that all common areas are cleaned. For any of us, though, for people that live in apartment buildings or for people we support who are in apartment buildings, I would hope that we would treat all common areas as though a person with COVID-19 had walked through them anyway. And, you know, to the extent possible, avoid touching surfaces, using hand sanitizer or soap and water to wash our hands after passing through, or if we have touched anything, and avoiding touching our face if we've touched any of them, or just avoid touching our faces generally. So the threat from someone, it is not an obligation on a person to report to anyone. It's labs, I believe, who report the information to DC Health, and then they go from there, because they get the information about where the person lives who tested positive.
Hi, I don't know if we're unmuted. This is DC Health on the line. This is Daryl Hawkins, and yes, that last point is correct. When we get a positive test results, the labs are reporting that to DC Health. In addition, if we are prioritizing contact tracing for those in high-risk populations, and if that's the case, then we're notifying those individuals that they were exposed. However, that doesn't necessarily mean that we're going to every apartment building and letting them know unless they're part of the contact tracing that we're doing. But yes, the labs are responsible to report that to DC Health, and healthcare providers are who get those results, but individual apartment complex are not part of that requirement to report. Thank you.
Thank you.
It has been 7 weeks since this began, and I understand that you will be providing guidelines at some point next week, but the third paragraph of Section F of Appendix K provides for an increased reimbursement rate for costs associated with homes that have been medically quarantined. The section goes on to talk about the hourly rate, but there is no reference to residential supports or supported living, which are both billed as a daily rate. Per DDS budgeting, the hourly funding rate for DSPs since January is $14.65. What are providers supposed to submit invoices for the enhanced rate for residential or supported living?
When we send the transmittal out that includes the rates, it will include the adjustment to all the daily rates so that people can see how those rates are affected by the adjustment that's been made for the overtime factor in the first provision. So we've adjusted all the rates to account for that, and the adjustments that are made in the so-called quarantined rate, as well as the quarantined overtime rate, and the retainer rate. So we will have quite a detailed and extensive transmittal that will go out that will provide all of those individual rates.
Okay, any additional questions? Appendix K allows for the temporary addition of emergency counseling. We'd like a clarification on whether or not MHRS is the service that can be delivered.
One of the provisions in the Appendix K application refers to emergency counseling. The district did not include that in our Appendix K, so that's not one of the services that's been approved by CMS for the district's Appendix K.
Okay. In other states, VR offices are authorizing a skills training milestone because providers can't get clients beyond placement. It's a way to keep clients engaged and prepare them for work and get revenues to the provider. Does RSA have anything like that?
Not exactly. However, as a person is referred to any of the, we've talked a lot about sort of the milestones in terms of job development, but as a person is referred to a provider for job development, and like you say, job placement might not be an appropriate short-term goal for the person, so what kinds of services would be appropriate in the interim? When the provider does their initial assessment and individualized work plan or person-centered plan for employment, what they could do in there is make recommendations about what services would be appropriate for the interim, so that, for example, the one I gave, I think, last week and the week before, if you had a person who had just finished their cosmetology and they're interested in doing barbering or becoming a hairdresser, and obviously, well, unless they're in Georgia, they could start next week, but in D.C., you know, you're not going to be able to go get that job for quite some time. You could make recommendations about appropriate training, soft skill training, job readiness training that might be able to be provided in the interim so that you keep the person's skills up. I would be curious if you could share with us, this came from Southsea, right? If you could share with us where you talked about they had milestones for training, if you can share what those were, I'd be very interested to see them. So if you could go ahead and email that information to us. I've also heard of a number of states whose VR agencies have just closed during this time. But we are very interested in continuing to work, maintaining, you know, being as active as possible and working with you to help as many people get to work who could right now and to get people back to work when this ends. So if there are ideas that we haven't seen from other states and you can share them, I'd really be interested in looking at them.
What are we doing with the data we are collecting, and will the mayor begin to publish this? Is Health and Wellness collecting and collating data as to positive cases regarding symptoms, interventions, and positive outcomes?
So I'll speak to the health and wellness effort. The transition nurse practitioners are working with hospitals for those people who are hospitalized, working on transitioning plans. The actual nurse consultants assigned to providers are checking up on people who have tested positive but are asymptomatic and who are at home. We're tracking the date of exposure, i.e. when the person who tested positive that they were exposed to actually was confirmed positive, and we're also tracking those who have been exposed because of staff, and by checking up on, we're collecting whether the person's symptomatic, we're checking up on whether the person we also have data for those who were monitored and are now hospitalized after testing positive and symptomatic. So we're checking a lot of areas. We're also tracking natural home reach outs of people who have tested positive in natural homes. There are very few. And we're also providing technical support to providers and or families who are supporting people who have been exposed, as well as those who have not. So we have a lot of data. We are going to be sharing that data online. Not all of that data, but the data on positive cases, the data on deaths.
So we do track daily, and as Winslow says, it will be shared publicly beginning very soon, and in which format we'll be sharing as that decision has been made.
At this time, I'm just going to ask DC Health. I think you want to clarify some questions on PPE. You are unmuted.
Yes.
Hi, this is Victoria Alabi with the DC Health and Medical Coalition. I just wanted to clarify the question about PPE. So, yes, DC Health is using the Health and Medical Coalition as the kind of forum to disseminate PPE to healthcare providers in all settings. I just wanted to clarify that you do not need to be a member of the DC Health and Medical Coalition to receive PPE. Generally, we work with our members on planning response operations related to emergency preparedness, and so naturally we are the lead within HEPRA to have those relationships and also coordinate those resources, but in no way, shape, or form do you have to be a member to send us your assessment of PPE and be considered for that distribution. So if there are folks on the line that do have needs and you are providing health services to your populations, you can email coronavirus.dc.gov or at dc.gov, and we'll send you a form. It's a PPE assessment form where we ask you to identify your burn rates, tell us the type of procedures that you're doing, so that we can evaluate if we have one availability and how much we can disseminate. So we again thank you all for what you're doing, and we thank you all for what you're doing, and please know that we are here to support you as much as we can. Thank you so much.
Also, you do not have to be a member of the Ian Parago's group to get PPE. So you can just go to, we typed in the chat, the coronavirus at dc.gov to get the form.
Yep, and I mean, what we tell all of our members is it's not obviously guaranteed. Our supply is just as limited as everyone else's, but we want to leverage our access to the federal government supplies and want to be able to support you as best we can. So do continue to source, do continue to share amongst one another, but we are here to support if we can. Thank you so much.
It seems the service coordinators and waiver unit do not understand why it is important to keep the PA for the services not being provided currently, so that when we can bill for retainer payments, we will be able to do so without delay.
So first of all, it has been my understanding that no prior authorizations for DAHAB have been deleted for that purpose, because we didn't know and do not know when this is going to be over, and to mass reauthorize would not have been prudent. So I'll look into that, but to the extent that any service coordinator is, how you say, confused, I would expect that you could call me and we could talk about it. We have 90 service coordinators. We do the best at ensuring that they all understand, while we change our processes, what's going on. There may be those who are, as you say, not, who are confused, but please call me at 202-730-1618, or you can email me at winslow.woodland@dc.gov, and I'll address the individual cases. So, go ahead.
There has been mention of the DDS COVID crisis team. Who is on the team and who's responding to COVID-19? And is Dr. Brown involved with all positive cases?
Okay. So DDS does not have a crisis team. That term is being floated by a lot of people, but what we do have is a physician consultant who continues to be involved in clinically complex cases, to include some that are COVID, and those referrals are being handled when made to him. We have 2 nurse practitioners who who work with hospitals to transition people once they're hospitalized back to home, and to elevate any concerns about those hospitalizations to me, and then they are referred to our physician consultant. We have 10 registered nurses who are working with all positive diagnosed cases. We're also monitoring people who have been exposed to positive cases. They are also reaching out to natural home family members to ensure that they have the current information that's being put out by DC Health with regard to mitigation and hand washing, and also just giving support to people who are experiencing this change. So we don't have a crisis team. We have a bunch of committed professionals who are working together to stem the tide of this and provide technical assistance. And we're working with DC Health, who I'm on the phone with just about every day. We also have a nurse educator who has developed technical assistance that is being shared, and he also has made himself available to the directors of nursing of provider agencies to discuss mitigation strategies. So if people want to call that a crisis team, they can, but we haven't formally designated our team of clinicians as a crisis team.
Was that the?
If DDS is requesting information from providers that are already stretched thin, it would be appreciated if you would give us enough time to respond. Sending out a request at 11 a.m. and asking for a response by 3 is not being a good partner and puts more stress on providers. A minimum of 24 to 48 hours would be appreciated.
So with regard to requests for information, what I would just like to say is that we're responding to requests for information as well. And secondly, I would hope that providers who are larger and who have actual quality management systems would have information and data. Nothing I believe that we're requesting is that you should have the information, basically, and if you don't, maybe we can talk about that offline. But what we're inquiring about regularly is the symptoms of people who are supported. What we're inquiring about regularly is staff that you know who have tested positive. We're inquiring about your ability to manage particular homes with regard to the mitigation strategies. So to the extent that any of the requests you find are onerous, I'd like them sent to me so that I can address them individually. And to Kirk Dobson, who is the Deputy Director of QACMA.
Because this is Andy. I mean, the reality is we recognize, I mean, all of us are getting sort of, immediate requests for information and then communicate that down to the appropriate sources. And when that is an issue, just please let the person know. We are not intending in any way to add to your stress. When we're asking for information, it's about ensuring, in most cases, I think it's about ensuring the health and the safety of the people we support and of all the employees. And so, if the time frame is too tight, just let the person know, please, so that we can be more realistic. I appreciate how stressful these times are.
Just to add one last thing there, if anyone's having any issues with the request that went out in the last couple of days and weeks regarding the employee coordination and your list of employees, please feel free to reach out to me directly if you have any issues with that, and we'll try to work out the best ways forward. My number is 202-730-1754. Again, 202-730-1754, or you can email me at kirk.dobson@dc.gov. Thanks.
So as I just said, if the request that's being made is too onerous, just as Kirk just gave you his contact information, contact him and let him know what a reasonable turnaround time is.
Are there any additional questions? Please type in the chat box. Can you update us on the frontline testing? How will it be rolled out?
Not yet. Winslow can speak some to it because he's been working closely with the person, or reaching out to and working with DC Health and the person from the public health labs. But I don't know if I mentioned, now we have the 2 calls, so I forget what I've said on which one. The mayor did change there was a change this week in DC Health guidance, and the mayor spoke about it on Wednesday regarding testing, so that up until this week, testing in the district was only for people who are symptomatic. But in the mayor's press conference on Wednesday, she spoke about providing testing for people who are asymptomatic, but it was for high-risk populations who are asymptomatic and have had a contact. And so we immediately then reached out to DC Health, and we are working with them and the public health lab so that we can figure out from our side, and then we're going to be reaching out to all the providers so that together we can identify who all would fall in that category of high risk, so that we can move forward with getting all of those people we support tested. The testing for people who are not symptomatic did not expand to include employees that work directly with people. For them, it's still only testing is only provided for those who are symptomatic.
I know RSA providers would typically assist clients in taking them to job interviews and so forth. However, during this pandemic, are providers still being asked to provide transportation to clients, even if team members are not comfortable in doing so at the moment?
No, and they shouldn't be, and please tell me if they are. Because, what we have said, and there's the guidance for employment providers on our website, I don't think it gets to this level of detail, but certainly the underlying idea in all of our guidance is following the public health guidance that we have received about ensuring everyone's safety, which means following social distance guidelines. I guess there's the possibility that you could drive someone somewhere as long as both of you wore face covering. We are not asking people to do that, and I think it's reasonable for someone to defer doing that. The question I would have, quite frankly, is if part of a person's plan to get a job, so if a person is going to get a job in a particular location and that person independently can't travel to that location for the job interview, how would they be traveling to that location to begin employment? And so I think that would get to even their readiness to start employment right now. What we have said is that to the extent that services can be provided in a manner that is safe because, maintaining social distancing, doing remote services to the extent that you can, then they should continue. But no one is expecting you to be doing on the ground job development with people at this time. We do have a number of our staff who are on this call, including, I know, the deputy for RSA is on the call. I don't see all the folks who have called in, but I do know that when we have these calls, the communication that's shared in the calls is then shared also with all of our staff.
We've unmuted Darrell Evans, Deputy of RSA, if he wanted to add anything.
I would just echo what Andy had just alluded to. And again, when we're talking about transportation, we certainly are talking about using the social distancing platform if it is appropriate. And to the extent you're being asked to provide any solutions to transportation, which will be reimbursed by us, we're talking about in the context of maybe a Metro card or some other transportation that is still within the realm of doing this. I will provide my name and number in the chat box if you have any direct questions. We had a RSA team meeting and we reinforced this again in our meeting this morning. So if you're getting contradictory information from any of the RSA staff, please feel free to reach out to me and my information will be in the chat box.
Thanks, Darrell. Why is PPR going forward in the midst of this pandemic?
So PPR needs to continue because we still have to make sure providers are, we still have to get those measures in on a quarterly basis according to the schedule that your QRS is assigned. We still need to make sure that you're meeting your goals, especially ISP goals for the people that you serve. So PPR must continue, and we will continue to do that. In addition, as I think Andy mentioned before, we'll continue our environmental reviews because we have to make sure that we maintain health and safety standards within each facility. So those two reviews will continue from QAPMA during the course of this emergency.
Are there any plans or discussions to include staff in the testing? They are doing this all over the country. We will not mitigate the virus until we get this in place. How can we help get this in place?
I'm hoping that DC Health perhaps would like to address this. I don't know if we have the folks from EPI at DC Health.
Hi, this is Daryl Hawkins. We are part of the EPI team. So looking at the question, yes, so if somebody is, we are, with the mayor's orders, we are now being able to, oh, Emily's here. Perfect. Emily Blake is here, who is the head of our HAI EPI team, so it was a perfect timing. The question, Emily, is about including staff in testing and what are our plans on DC Health EPI on the testing for staff. And I was about to talk about symptomatic and asymptomatic and how things have changed, but maybe you could speak to that.
Sure. So yeah, I guess so right now, so DC Health is no longer approving, or we are facilities no longer have to seek approval from DC Health to do testing through the DC Public Health Lab. So it's a similar, you can use the DC Public Health Lab the same way you would use a commercial lab. So you just work directly with the lab.
Oh.
I will say from an epidemiological standpoint, we, testing asymptomatic residents, that makes sense because then you understand how to cohort the residents and you can, maybe better anticipate, pre-symptomatic infection. However, with staff, I would say tread lightly with that. The main reason is if you test staff and they're negative, it's still really important that you still continue to monitor them extremely closely, and likewise with residents. But, with staff, we just don't want everyone to get a false sense of security that if they have a staff member test negative, that they might stop wearing, they might become less vigilant about their mask or PPE use or monitoring their own symptoms. So, with staff, it's I think it's a little more difficult because the staff are going in and out of the community, whereas the residents are staying in the home. So, I guess, I guess I would just tread cautiously with testing staff. And then, there's one more thing I was going to consider. But yeah, I mean, but ultimately it's at your discretion who you all want to test. Also, as far as supplies go, keep in mind that there's a shortage of testing supplies and reagents at times. So DC Public Health Lab, they're only going to be distributing a maximum of 10, I guess we'll call them swab material kits at a time. So, it's going to be very burdensome for you to have to just constantly be requesting kits, or just keep in mind there's going to be a lot of logistical burden with just doing like mass screening of staff as well. Did I answer the question? Yeah.
Hi, are there any other questions? Please type that in the chat box.
Okay, it appears that we are finished with questions. Once again, I do want to thank all of our providers who really, you mentioned in one of your questions about, please limit how much you're asking from us because of what a stressful time and a challenging time this is for you, and we do recognize that for you and for all the people that work for your agency in terms of really trying to get through this and keep the people that all of us are here to support healthy through this whole public health emergency. And please communicate to them how much we appreciate their dedication, because it really is amazing the level of dedication that staff have to continue this work throughout this public health emergency. And it does not go unnoticed at all. It is really appreciated, and it is, at all levels, people are aware of the dedication of the staff to ensuring the health and the safety of the folks, the very vulnerable folks that we support. So thank you, and we will talk to you again next week.